topic we'll be discussing is the parenteral drugs, which are used in case of the hypertensive emergencies. So we'll be looking at one by one. First, we are looking at the beta blockers. So what is special about the beta blockers? So here, first we need to know some common drugs. In beta blockers, there is the labetalol. Next comes the esmolol, as well as the metoprolol. So these are the drugs. And other thing we need to know is the contraindications where it should not be given. So this includes the heart block. Next comes the systolic heart failure, and then the asthma and bradycardia. So the parenteral drug we saw first is the beta blockers. Next, as we move on, we will look at the calcium channel blockers. So calcium channel blockers. So under the calcium channel blockers, the examples being the clevidipine, as well as the nicardipine. So they are some examples. And where is it contraindicated? The calcium channel blockers, they are contraindicated in case of the advanced aortic stenosis. In case of the advanced aortic stenosis. Next, we will look at the D1 receptor. So the D1 receptor agonist. So what happens here is that the example first, it includes the phenoldipan. So contraindicated. So where it is not supposed to be used, this is in case of glaucoma. In glaucoma, the D1 receptor agonist should be cautiously used. So the example we saw was phenoldipan. Then we go on to a class of vasodilators. So under the vasodilators, there are some examples such as there is nitroglycerin. So under this nitroglycerin, the example is there is a pericardial tamponade. Next comes the nitroprusside. So under the nitroprusside, it includes the relatively contraindicated so it is contraindicated. So here also the example we saw was nitroglycerin, and the contraindication here is the pericardial tamponade. Now moving on to the next, that was the nitroprusside. Here the contraindication is in terms of the liver failure. So in terms of the liver failure and the renal failure. Case of liver failure as well as in terms of renal failure. Next, we are looking at the hydralazine. So what happens in the hydralazine? So under the hydralazine, this includes the contraindications, that is the CAD as well as the RHD. Next, we move on to a class known as the ACE inhibitors. So under the ACE inhibitors, the examples such as the enalaprilat. So here the contraindication is nothing but in case of history of the angioedema. Then we look at the alpha blockers. So under the alpha blockers, the examples being the phentolamine as well as the urapidil. So these are some examples. And what are the contraindications? The contraindications of alpha blockers is in case of the A for A, that is the aortic stenosis, as well as there is another A which is for the AV shunt. So we saw about the alpha blockers. Next we'll be moving on to the centrally acting sympatholytics. So centrally acting sympatholytics. So under this, the example is clonidine. So this is an example is clonidine. So where is it contraindicated? The contraindication here is in case of a severe, in terms of severe AV block, as well as in case of the sick sinus syndrome, in terms of sick sinus syndrome. So this was all about the parenteral drugs used in terms of the hypertensive emergencies, and we saw various classes of drugs, their classification, the drugs, as well as a part of the contraindications. To learn and grow daily like this, please do subscribe.